All right, Heartbeats, how are you today? Already know this is Sharon, the Heart Lady, and I have another very special guest, really interested, so stay tuned. Welcome to Heartbeat Station, where you get to tune in, turn up, tap in. This is the place to be if you want to meet different holistic practitioners and discover how they assist their clients on their healing journey. Maybe this is the day you'll find someone who can help you or your loved one or someone else that you know. So, the name of my guest is Dr. Paul Dabney, and he is owner of the Center of Natural Health and Optimal Wellness, located in Decatur in Atlanta. So, not too far from where I am, Decatur, where it's greater. All right, haters.
That's cute.
So, Dr. Paul at Dabney, can I call you Dr. Paul?
Yes, ma'am.
Thank you so much. Welcome, welcome.
Thank you for having me. I enjoy it.
You are so welcome. So I know that you have a specialty, and I know that you are a medical doctor, right? Or
I'm a
a
naturopathic
naturopath,
doctor. Hmm.
naturopath, which is my
Yeah.
favorite. I love naturopaths. So here's a hug. Thank you so
Thank you.
much. Thank you so much for coming on and really letting our viewers know that there are other alternatives. I noticed that you said integrative. Could you tell me what integrative means in your own
Yes.
definition?
Yes. In a short version, integrative medicine is the blending of alternative medicine with conventional medicine. And this
Mm,
is pretty much, I get asked that question a lot. I know there's probably different versions out there, but this is what I tell my patients is it's the blend of conventional medicine and alternative medicine.
mm,
So you're actually just blending the two or integrating the two fields together.
yeah.
And the reason why I like or got involved with integrative medicine is because most of my patients are seeing a conventional doctor. The majority of them are. So if I'm going to be able to help them effectively, especially when the conventional medicine may not be working as well as it should, then
Mm.
my job is to find another way that is complementary to the medications that they're on. Because I know there can be a lot of overlappage and stuff like that, but not all of them interact with the certain conventional medicines. So I
Yes,
have to figure
absolutely.
that out. Right.
Yeah. Because I know that a lot of people hear, oh, take garlic for high blood pressure. And then I know that garlic, taking too much of
Yeah.
it every single day can also be detrimental to health, to your
Correct.
liver, and
Correct.
and particularly to your liver. And so knowing just trying to do things all by yourself and what you may read on social media or even what you went to Google to find out you're not doing it where you are truly being monitored and
Correct.
understanding and knowing what you're missing. You may think that it's this particular uh, um, supplement or mineral or what you're using as an antibiotic. You heard that everybody else is using it and it may not be good for you. I think that's one of the differences with using the type of medicinal antidotes that we use versus the ones that are okay, everybody take 325 milligrams of aspirin and this is going to help your heart, that type of thing. We are not in measured. Everybody is kind of customized and
Mhm.
individualized. Would you say so?
Yes. Yes, I would.
So, Dr. Paul, I've heard of functional medicine. And I know some of our viewers are kind of confused between functional medicine and integrative medicine. Is there a difference between the two?
There is a difference. There is going to be a little bit of overlappage between the two. Like there's an overlappage between alternative medicine and complementary medicine. Okay, so that there's a little bit of overlappage. But as far as functional medicine is actually okay. So all of your organs, all your body, all works together as a unit. Some people don't think of it as that way, but your liver and your heart, all those organs are all kind of intertwined. So when one organ is having some other issues, it affects the other organs or the system as a whole. So functional medicine, what that is actually looking at whatever the person's ailment is and trying to find out the actual root cause of that particular problem. They're
Okay.
trying to find out. That's why I say it's a little bit of overlap, because a lot of all other particular medicines do that, but some of them take a different approach. Like for example, if you're having problems with your pancreas, if you don't control that, since the pancreas and the liver are in close proximity,
Yeah.
if you're having problems with your liver, you may start having problems with your pancreas just because of the proximity.
Proximity. Yeah.
Right, so close they are.
Yeah.
So
And our body
your
works
job,
in harmony. All the organs
right,
work
right,
in harmony with each other.
right. It wasn't too long ago when people went to medical school, they were taught them as separate units.
Mm.
I mean, it went on for years. They went on for years.
Mm.
They were taught as separate units, and we all know that your body works together. When you remove one organ, the other organs have to compensate, even though they're doing different things. It's still a loss, and that's still got this space. If you have it removed,
Mhm.
and all of them will work together as a unit. So that's another thing that functional medicine does. It takes that in consideration,
Mm.
that they're all
Okay.
the bodies working together.
Yeah.
And that functional medicine doctor's job is to find out the actual cause. Once you figure that out, you're pretty much on your way to helping them feel better.
Okay. And you
Yeah.
chose integrative medicine. And was there a particular reason why you went that route?
Well, I went that route primarily because, I might still go to a conventional doctor, but a long time ago, I was having some acid reflux issues, and I started looking at how they were treating me. And I said, this doesn't seem to be right. I'm fine one day, then I'm not the next. I said, it's got to be something else. So what I started doing was I started doing more research and, dealing with acid reflux, and found out that, I was not producing enough acid.
Mm.
Conventional way would be you're producing too much
Too
acid, and
much.
that
Right.
wasn't the case, and they don't really look into that per se.
Wow.
Now you can take a camera and they could swallow it, and then they can measure your stomach acids. That's pretty invasive.
Hmm.
Um, but as we age, we start losing our digestive enzymes, our acid levels start to drop, and that's probably one of the first things that we encounter, start having problems with our digestion. And as soon as we start having acid reflux symptoms, people automatically assume that you are having your stomach acids is too high.
Mm.
It's too acidic.
Acidic. So
You
now is
really,
that one of the reasons why they have all this pH water out there and everybody's alkaline and
that's one of the reasons why they're doing that. And I have to tell them, this is there's nothing wrong with the water per se, and you have to be careful because your pH in your stomach is acidic, right? So it's about 3 or 4. If you drink an excessive amount of alkaline
alkaline.
water, especially with your meal, it's
Mm.
with your meals where you come a problem. And when you start taking it with your meal, you run a pretty good chance of, of basically diluting out your stomach acid. Now you're not digesting your foods very well, and then you still have the problem of acid reflux issues,
Reflux.
even
Yeah.
though your stomach acids may be more on the basic side.
Mm.
Not going to
Interesting.
digest your food. So I tell my patients is when you're not digesting your food very well and your stomach acids are not where they're supposed to be, the bacteria starts working on that undigested food,
Yeah.
and then it ends up causing abdominal pressure, abdominal pain. And when that happens, the pressure is either going to go up or down. Most
Mm.
of the time, it's going to go up, and it takes the
Right.
acid along with it, and then you have acid reflux. So, in a
Mm.
nutshell, you can have acid reflux symptoms with too high of an acid or too low of an acid. Okay, so to get back to your answer to your question, I started investigating this, and I was able to figure it out. And I says, well, maybe there's a way to help other people with other different things if I can actually integrate what I learned and
Yeah.
integrate it with conventional medicine. And
Yeah.
that's one of the reasons why I chose that field.
Integrate. Do you collaborate with the PCPs from your patients or is this
I
different?
I I I try to collaborate as much as possible. You know, some of them are pretty open of the
Okay.
collaboration. Integrative medicine or
Okay.
alternative medicine. But for
Yeah.
the most part, once I show them what I'm talking about, I usually like to write everything down so I can just say, okay, you need to read over this. If you have any questions, just let me know. I like to basically write everything down, and sometimes we'll have a conversation. So this is not bad. I thought about it this way, and you start to try to establish a relationship, you know,
Mhm.
with them. And so there's sometimes refer their patients to me, and then I refer, you know, my patients to them. So you
Yeah.
just try to establish a relationship.
Yeah. Yeah.
Some of them,
I was
yeah,
thinking
they
that
don't want
since
to do that.
Yeah, I was thinking about that since it is more integrative and you are looking at some of the things that their primary care practitioner has told them. I did hear
Correct.
you in your conversation say the difference. People also say complementary versus alternative, and I kind of thought it was the same thing. Is there a difference?
They are the same. It's the it's the terminology. It's the way.
Okay.
Okay, alternative medicine is an older term, and
Okay.
then I think probably in the 80s it became complement, like you're complementing the uh, alternative medicine with conventional medicine, and
Yeah.
as basically these terminology are more of a generational type of a thing.
Okay.
We
Okay.
went from alternative medicine to complementary medicine, and then integrative. You
And
know, now you got
yeah,
functional medicine.
and
I
now
don't
we're
know how many
doing
different
and
types of
now we're
medicine they're going to
doing
deal with. But,
TCM, traditional Chinese
oh yeah,
medicine.
okay.
So now
So,
so you said
oh,
generational, where
right,
we are in what era?
right, right. So I come from
Okay.
an era where it was alternative. Oh, you know,
Hmm.
alternative. I
Yeah.
remember when my mom, um, this is going back in the 70s, there was a magazine called Prevention
Yes.
Magazine.
Yes,
Yeah,
I
Prevention
remember it.
Magazine is a magazine that talked about alternative medicine, supported by research,
Yes.
and a lot of people did not like Prevention Magazine because it was more of a, it was basically giving people choices, and it talked about information, and medical
Yes.
community did not like it, and they
Mm.
balked at it, they debunked um, its authenticity,
The
you know,
validity. Yeah.
right, validity of it. So they I don't know if it's still around or not, but my mom used to get it. I used to read it. You know, I was like maybe 13 or 14 years old,
Yeah.
and
I
I
remember
would
that
I
magazine.
would
Yeah.
read that magazine. I really didn't understand what was really going on, but I still like to look at different approaches and stuff.
Yeah.
She said, "Well, one day there's going to be a time when they're going to blend this together."
Wow.
And I'm like,
So she
"Okay."
saw that way back then,
Right.
and
So
it's absolutely true.
she was kind of futuristic on that. Yeah.
So I know that a lot of your patients come to you for stress management or anxiety, and I know you also have an interest in working with those with thyroids and particularly
Mhm.
gut health, as you were talking about uh,
Correct.
um, reflux, which
Mhm.
also definitely has to do with gut health. And we know that gut health, having understanding, I know there's a terminology that's going around about microbiomes and really
Oh yeah. Yeah.
understanding gut health and how it is also impacts total well-being. And I know that there are some school of thoughts that gut health also has its own brain and how it works independently, and how we need to make sure that we have, there's this whole big thing now on probiotics,
Right.
probiotics, prebiotics. It can be really confusing. And then of course,
And free
and then
free
of course,
bodies. Right.
thyroidism. I do, oh, my thyroids, my hormones are out of whack. And I'm like, whoo,
Well,
give us a little tidbit on that.
okay, so the relationship between the your microbiome, okay, so that's your the gut good bacteria and the bad bacteria that resides, you know, in your primarily in your relationship, and you want your good bacteria to be greater than your bad bacteria, because the good will actually keep things in balance, keep things in check. If they become out of balance, then you're going to start looking at some major problems. So the reason why there's a relationship between the thyroidism and poor gut health has to do with the conversion of your thyroid hormone. Okay, so to not go into a lot of great detail. So you've got they always call it thyroid hormone, but there's two. There's a T4 and a T3. Okay, and T4 is converted to T3. So if a person is going to have some thyroid problems, and if they're inflammation in the gut or bad, the overtake of bad bacteria, the body is going to have a problem making that conversion from T4 to T3.
Okay.
And when that happens, T3 is the workhorse. It's actually stimulating the rest of your body to tell it what to do, because the thyroid is not limited to the thyroid. It's basically an energizer. It really stimulates the body to produce some energy. It does a lot of other stuff too, but that's one of the main jobs. If you start having inflammation in the gut, poor gut health or whatever, the lack of conversion is going to take place. So your thyroid hormone is going to start falling off the curve. You can't make that conversion very well.
Right.
And a lot of your conversion primarily happens in the gut.
Mm.
Okay.
I didn't know it
So
happens in the gut. So do you hear that, folks?
primarily in the
In
gut.
the gut, not in the
Mhm.
thyroid.
No,
And
right.
it's not about the hormones per se. It is about how it's converted. So, Dr. Paul, how do we know that we are even having gut issues?
Oh, okay, that's a good question. Each person's going to may have different symptoms. One of the things that you'll start having problems digesting your food. Sometimes you'll have abdominal pain. Sometimes there'll be constipation. There'll be diarrhea. Um, one big thing is that not just older people, but some younger people, they may start seeing um, undigested food in their stools, or they're going to start seeing medication that's undigested in their stool.
Oh, wow.
That's a big thing. If you look at talk to people that live that they're taking care of the elderly,
Yeah.
like assisted living
Yeah.
or some type of nursing home. A lot
Yeah.
of the times when they're changing them, they'll start seeing basically bits and pieces or whole pills in their stool, which means they're not getting the dose. Their medication is just pretty much going through them,
Yeah.
and that becomes a big
Yeah.
problem.
So you said a
Um,
key thing there. One of the things that someone can do is after they pass that stool, turn around and look at it, knowing the
yeah, most people don't
formation,
want to do
knowing what it looks like.
that. Right,
Actually, that's what made me stop eating corn because it was not I was like, I'm not digesting this. Whole pieces of corn are
right,
coming.
right. That's because it's an insoluble fiber. It's an
Mhm.
insoluble. So you're going to, it's not going to do that. A lot of the times that corn or popcorn, the whole of the popcorn, a lot of times that gets caught in the folds of your intestines, and that could
Mm.
cause some diverticulitis or
Mhm.
diverticulosis. So
Oh,
basically, one is a collection of it in the pouch of the intestines, and then the other one basically is creating inflammation because the body, it gets stuck, and then the body
yeah.
starts reacting to it because it's stuck, and next thing you have inflamed.
So, Dr. Paul, is also an indicator, so some people have this bloating and they may
Oh
think that
yes,
they're
forgot
just
about
putting
that.
on the weight, but is it
Right.
just this bloating and does it feel hard or does it feel
Yeah,
soft?
it's gonna actually feel. It depends how severe it is. Sometimes it can be really really hard. You pressing on your stomach, it feels like a basketball. It's
Mm,
completely inflamed. I mean, inflated, so to speak.
hmm
It's really gets really tight, like a drum. But for some, may not be that bad. It depends on what they're eating. So
mm,
what triggers that? There's a couple of reasons that may trigger that. One of it has to do with the acid levels in your stomach, in your stomach is not up to speed. It's not there. So
hmm
remember, I was telling you that once it goes through your stomach and if there's not enough acid to break it down,
Yeah.
it's going to dump it into the small intestine, and then the bacteria get a hold of it, and they kind of will start trying to break it down as much as it can. But if you have a lot more bad bacteria, they're not going to be work in your favor. They
Oh.
end up producing more byproducts
Mm.
like gas, things like that. And your body will respond to that. Your stomach will start swelling up. You start having the bloatiness in
Mhm.
the gas. Another thing that's really big is the brain fog. The brain
Mm.
fog. Once you can't get rid of this stuff very well, and
Mhm.
especially if you have constipation. Constipation is really bad because the body is pulling off the fluid from the stool that's sitting there. Is not You're not moving it, so the
Right.
body will pull off fluid from it. And in the stool, there's waste. That's why your body's getting rid of it, and it recycles the waste.
Mm.
And next, you start having all these excess chemicals that are going in there, and your brain responds to that. And you start having brain
Oh. So I know
as
a lot
one
of
of the.
people think a lot of the brain fog has to do with the thyroid, but now you're teaching us that the thyroid and
It's
gut health are
okay. So here's
working together.
yeah. Here's the rub. The rub is the thyroid interacts with the GI tract. Remember, I
Mhm.
was saying that it goes from T4 to
Yeah,
T3. The
yeah,
T3 stimulates the body to carry out an action. In
yeah.
this case, is to help move or cause your intestines to push things through. If you don't have that on board, if you don't have enough energy on board to do that, you start having more constipation. And that's what
Mm.
happens to people who have a hypothyroidism, is that their GI tract starts to slow down, becomes more sluggish.
Mm. And with hypo, that's when people are
Hyper, yeah,
gay.
hyper is you're speeding up things. Your things are sped up, and you're more likely to have more diarrhea than constipation.
Diarrhea. So
Yeah.
is it hypo when they start to gain weight?
In most cases, yes, because
Mm.
your GI tract is slowing down.
Mm-hmm.
It's not moving things very well.
Mm-hmm.
You become constipated, become bloated.
Mm-hmm.
Since you're not breaking down your food, or you're
Mm-hmm.
breaking down your fat, so to speak. So everything is slowing down. So they'll start converting things into fat, because
Wow.
you're not
Yeah.
digesting things very
Yeah.
well. One thing I did want to talk to tell you that most people don't look at the relationship
Mm-hmm.
between the thyroid and the adrenal glands.
Mm-hmm.
The
Fatigue.
adrenal
Mm-hmm.
glands are basically they're the glands that sit on top of the kidneys,
Mm-hmm.
um, and their job is fight or flight. That's what they're noted for. But they also are used to help get things moving. So when
Mm.
the thyroid starts having problems, like it's become more hypothyroid, the adrenal gland wants to help out by kickstarting the body, and it becomes activated.
Wow.
This
Mm-hmm.
is where the weight gain comes from, because the overactive of the thyroid, the adrenal glands starts to secrete a hormone called cortisol. Cortisol increases the sugar. Sugar is converted into fat. And that's where the weight gain. So there's a relationship between the two
Yeah.
organs. People don't
People don't
take
think about that.
right,
So
so they
it's
don't
not
think
just
about
that.
right.
So even so, what I'm gathering is that you may have thyroid issues. You need to also take a look at what's going on in the gut. And you also need to be aware of how your adrenals are functioning.
That
And with a lot of that, one of the common symptoms is extreme fatigue.
right, correct.
And so some people think is this because my thyroid, why I have brain fog and tired? But they don't know also it could be the things and the way you're eating that is also affecting your gut health. So it seems as though, so now I can
Correct.
see the integration.
So
It
there's
is
right. So
integrative.
now
Yeah.
you can see. I'm glad you see that, because a lot of the time, remember I was saying, they were looking at the body as separate entity. So you're
Yeah.
talking about medical students. It's going back, 50 years ago. Um, they were treating the organs as if they were separate entities, and as you can
Right.
see, they're not. So that's how they learned the systems, as treating them by separately. Now medical school
Mhm.
um, teaches them to integrate the parts, to look at them
Yeah.
as a whole,
Yeah.
not as a separate unit.
Right.
So I'm glad you
Absolutely.
brought that. So you can see
Yeah.
that.
Yeah. Oh, definitely, yeah.
You got
Because
that
one of
the
the
light
things that
bulb goes.
I do, one of the things that I do, I also teach basic life support, advanced life support, CPR, first aid,
Okay.
and I teach them that the respiratory system and the cardiac system work together. And talk to them on how, the symptoms are. So I get it. They talk to each other. The heart starts pumping really fast, and then the lung says, "Uh-oh, heart is in trouble." So now that's why you're having the shortness of breath. And they talk to
Right.
each other. And I wish we as people could talk to each other as our body mechanics do.
That's a good connection.
Yes,
That's a good connection.
absolutely. I
Yeah.
This is fantastic. I would definitely want to talk a little bit more in some of those subjects. I know quickly before we leave that you also had talked to a lot of patients who have sickle cell. How is that
Yes, ma'am.
playing?
Yes.
Yeah.
Yeah,
So,
that's one of my priorities. Is I get on the sickle cell forums, and a lot of the times, they're saying the same thing. They're not getting the support that they should be giving. And now with this, the gene therapy and CRISPR and all those other different techniques are available. It's not available for everybody because it costs too much.
mm,
So what I try to look at is looking at, not curing anything per se, but what I'm trying to do is work with them to help prevent their sickle cell crisis or reduce the sickle cell crisis effects. There's a bad relationship that they're on these pain medications and they're on them for long periods of time, and eventually the body is going to stop responding because the body is going to become resistant to those pain meds, and there's a mechanism for that.
mm,
So they go to these pain med doctors and they give them pain medications, so the pain receptors go up because they're activated, and you keep doing this, the receptors are not going to respond,
mm.
because if I keep hitting you over and over and over and over and over again, eventually there's going to be some damage, and the
Yes.
receptors are going to like, look, I'm not doing this. So it requires more pain meds to dampen the pain. That you might have to take so many like a lower amount of milligrams at one point in time. Now you've maybe 2 or 3 times that. That's
Yeah.
because that's because the body has become almost like resistant to that, and it requires more medication to do that.
Are you
So
finding that there are more, or is it more or less of those who have sickle cell anemia?
as far as what the
The
resistance,
numbers as far as stats, are there more? Is sickle cell going down, or is it going up, or is it
it's
just about the
probably it's
same?
probably more likely going up because now
Mm.
they've got people now being screened for sickle cell. There was a time when people weren't doing that in the hospitals. This is going back a long time ago. Now it's mandatory. Every child has to be screened, for sickle cell. So more people are getting tested, and they're catching
Yeah,
it more. So the numbers are probably going up because of that.
right. I
Because of
remember that was one of the reasons why you used to have to get a blood test before you get married to
Right.
rule out. Remember that?
Right. Yeah. So you have to get the blood test in order to do that. So I know that I have thalassemia. It's the beta thalassemia. It's not sickle cell, but it's a genetic blood disorder. It's a hereditary. So I've had it since birth. Problem is they didn't screen anybody for it. My brother had it. And he was in his 40s when he found out. He was in
How
the
do you
military.
find out? And
How?
do they
No,
screen now? Is that a
oh,
routine
well,
screen or not?
well, they screen only if you start having anemia. If you
Oh,
start having anemia, that put it this way, your blood work doesn't look right.
mhm.
If I looked at my blood, and it looks like someone took a hammer and broke your blood, not all of them, but the majority of your blood cells, like it looked like glass. Then
Right.
the next time you look at it, the majority of it looks okay. So it fluctuates.
Oh,
But
okay.
I found out somehow at 40, same age as my brother, I found out about it. It was more stress related. I went to the doctor. They thought it was more of an altitude sickness. I moved from Ohio to Tennessee to Huntsville, Alabama, and then I went back to Georgia. So they thought maybe an altitude issue. So
Oh, really?
they gave me told me to take some iron or whatever. That wasn't the issue. So long story short was, I found out after during 9/11 I found out that I had it, and the doctor who was from the Middle East. This is during the Middle East, right after 9/11. So people weren't too happy with the
Right.
people. And I said, "Look, man, I don't care where you're from. You're
Oh, that's
in the
right.
South.
If you can
You're in
help
the
me,
South."
help
So
me.
anyway, so he eventually it took him almost about a month,
Hmm.
and he comes back and he goes, "I think I may know what you have." I was like, "Well, what is it? I got to do one more blood test." I took the test, came back 2 weeks later. He goes, "You have thalassemia." I didn't know
Mm.
what thalassemia was. I wasn't in medical school yet, so I didn't
Hmm.
know what it was. And he explained to me what it's a genetic blood disorder. You've had it since birth, and it probably starting to reveal itself because you're older now. You're under a lot of stress. 'Cause my wife was in medical school, and was living a little bitty apartment. It was madhouse. But he basically said, "This is what it is,
Wow.
and whatever you do, don't let anyone give you iron." So a lot of times when I do go to the doctor, and I have to tell him, they go, "What is that?" And he goes, "Is it sickle
Mm.
cell?" No, it's a sickle cell.
Oh, yeah.
And I've never heard of that. So I even went to a hematologist and he had issues treating me.
Wow.
So I'm like, okay, so I need to figure out what I need to do. So what I have to do to treat myself, I have to make
Yeah.
sure that I have plenty of methylfolate and methyl B12, not as much as iron per se, but that actually keeps me up. And I get tired a lot, run down. Um, but I know the symptoms, so I know how to.
Yeah.
So that's the same thing like how I got involved with sickle cell,
That's
just
right.
finding different ways to heal.
So, heartbeats, you see, Dr. Paul got some knowledge up in here. And it's not just, he doesn't just go with, the okey doke. He really does the research. Talking with him earlier, may want to look at your records 5 years past because he taught me that, things go in cycles. And so he helps you to learn more about your body and you work together with your body, with him, and really get a greater understanding for, wholeness, for a whole well-being of your body. So, as we get ready, thank you so much for sharing, Dr. Paul. I've learned a lot, and I'm sure our viewers have learned a lot. But one of the things that I always ask my clients just before my guests just before we leave is, what do you do to take care of your heart health physically? What's a physical thing that you do to take care of your heart?
Well, if I'm going to take care of my heart at my age, I really want to make sure that I have enough of CoQ10 on board.
Mm,
CoQ10. Um, there's two types, ubiquinone and ubiquinol. You want the ubiquinol. Think of
okay,
alcohol.
okay, okay.
That would be one of the things, and also magnesium
Yeah,
and potassium. That
okay.
would be those would be the three things that I would be looking at or would be recommending to myself if there were some heart issues.
Okay. And what would you do, or what do you do to take care of your emotional health?
That's a good one. Dealing with emotions, you want to make sure that you got your serotonin levels up, and one way to get those up would be making sure you've got B6. B6, can actually helps make serotonin as well as dopamine. There's another one. It's another amino acid called theanine. Theanine. It actually works very well. It's actually the active ingredient in black and green tea. So they call it the Zen effect. It's
Mm.
so it gives you a sense of calmness, and I like that. I tell people who are going through stress, and also there's a neurotransmitter that your body makes. It's
Mhm.
called GABA. Um,
Yes,
Look, you've heard of GABA. That actually
yes,
works very well.
yes.
It does put you to sleep, so should be taken at night. Some people it's different, but the theanine is something I really recommend. I have my kids and my wife on it. Um, take it all the time. It de-stresses them.
Yeah. And
So yeah,
especially, would you recommend that for people who experience a lot of anxiety?
yes, ma'am. I would. It also for people who have get stressed, their gut, they have a tendency to have problem with the GI tract. That actually works very well with calming the gut down as well. So it's an overall systemic calmer overall. Yeah.
GABA.
Mhm.
Okay. And lastly, what
Just
do you
that.
do for your spiritual heart or health?
Well, I what I try to do is I try to attend church as much as I can. I also have people that pray for me.
Oh, that works.
I have a sister that's a minister. So she makes sure that she keeps me in line. But you do have to walk a good path and have a very good spiritual balance. So I'm glad you brought that up. Mind, body, and spirit. You got to be very much balanced in that. So
Yeah.
I try to do
Well,
that.
thank you so much.
Well,
So
thank you very
very
much for
much.
having me. I
I
really enjoyed
definitely
this.
enjoyed it. How can people get in touch with you?
Well, you can reach me. My business phone number is area code 706-244-4948. If you want to visit my webpage, it's www.cnhow.org. So I'm looking forward to hearing.
CN as in Nancy. CN how? CN
Yes,
is all right. All
.org.
right. I love it. I love it. .org. I will definitely post that in the descriptions.
Okay.
If your heart beats, listen,
Mhm.
if you really want to get a thorough checkup and understanding how your body and is integrated, how the organs are integrated, and it's a compliment to what you're doing. So
Yeah.
I'm saying visit Dr. Paul Dabney. Thank you once again. I appreciate you. You
Thank you
take
very
care.
much for having me. I enjoyed it. I enjoyed it.